And these are, of course, very common. So in a patient who has obesity, who has type 2 diabetes or hypertension, those patients are at particularly elevated risk. And that would require that a primary care doctor just consider the liver among the multiple downstream negative effects of having those comorbidities. So there's nothing specific at the outset without blood tests and imaging. It's just the suspicion needs to start with that.
Okay, so it's the collection of comorbidities, which we've talked about a lot on this episode series, and that's sort of metabolic syndrome, high cholesterol, type 2 diabetes, obesity. Would you include autoimmune disease in this?
I would not. I would include autoimmune disease as something that should be on the differential diagnosis if liver enzymes are elevated, but it is not an autoimmune condition. That being said, one of the most common autoimmune antibodies, the anti-nuclear antibody, it happens to be elevated in about 30% of people with metabolic or fatty liver disease. And so it's something that should come to top of mind, especially if liver enzymes are elevated in those patients.